Welcome to the Omni Dental Podcast. You know, most people think their teeth are turning yellow because they're just getting dirty.
Right, yeah.
But the truth is, your teeth might actually be turning yellow because they're becoming, crystal clear.
It's a totally counterintuitive reality of human biology.
Yeah.
I mean, we spend our entire lives trying to scrub away discoloration,
Yeah.
just assuming we're battling surface grime.
Yeah, exactly.
But in reality, the actual structure of the tooth itself is transforming right in front of us.
It's wild. I mean, when we think about changes to our physical appearance, we're conditioned to expect this straight line of cause and effect.
Mm-hmm.
Like, you get a sunburn because you stay at the beach too long without SPF.
Oh, sure. It's binary.
Right, it's binary.
Yeah.
But the moment you step into the world of oral biology and cosmetic dentistry, that straight line just, it shatters into a dozen different variables.
Oh, absolutely.
We're looking at this highly complex ecosystem where our diet, our childhood environment, cellular trauma, and, the relentless biological clock all intersect.
It really is the absolute definition of diagnostic muddy waters.
Right.
There's no single universal reason. A small changes color over time.
Right.
The environment inside the human mouth is just incredibly dynamic. It's constantly undergoing these microscopic cycles of demineralization and remineralization.
And so, to navigate the mechanics of those cycles, today we are taking a deep dive into the clinical approach of Dr. Bylas Poles and the team at Omni Dental and MedSpa.
Yeah, they really deal with the absolute extremes of this topic, treating everything from routine wear and tear to really complex traumatic dental injuries.
Exactly. And our goal today is to pull apart the underlying science of why our smiles change color. We're going straight down to the molecular level.
To really understand how stains bind, yeah.
Right. And why teeth structurally change color from the inside out, and how advanced dental care can basically turn back the clock.
Which is such a necessary conversation.
Yeah.
Because relying on generic, over-the-counter whitening strips without understanding the underlying mechanism of your specific discoloration is, well, it's essentially just guessing. You really have to understand the cellular architecture of your teeth to effectively intervene.
Okay, let's unpack this. Because before we can dissect the chemistry of a stain, we need to look at how modern dentistry actually approaches the concept of a smile.
Right.
We're anchoring today's clinical insights on Omni Dental and MedSpa, which is located at 305 East Rand Road in Arlington Heights, Illinois.
Headed by Dr. Poles, who has over a decade of clinical experience.
Yeah, and they manage a surprisingly large patient base. They cover Arlington Heights, Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg.
Wheeling, Des Plaines, Elk Grove Village.
Right. I mean, that's a huge area. But what is genuinely fascinating about their practice model is how they've structured their interventions.
Mm-hmm.
Going to the dentist used to just be about fixing cavities, right? Like drill and fill.
Absolutely. Very functional.
Right. But Omni Dental treats the entire canvas of the face and body. They blend dental care with this extensive med spa menu.
It's a huge menu, yeah.
So we're talking Botox, dermal fillers, microneedling, laser hair removal.
Even permanent makeup like lip blushing and IV drip therapy.
It's a true one-stop destination for overall well-being and confidence.
It is, and it makes complete clinical sense when you look at it through the lens of a patient-first mentality.
How so?
Well, you can engineer the perfect porcelain crown or achieve, optimal gum health with laser therapy, but if you ignore the framing of the face...
Oh, I see.
Yeah, the lips, the skin, the overall dermal volume. If you ignore that, you're really only addressing half of the aesthetic equation.
Ah, that makes a lot of sense.
Yeah, so Omni Dental's comprehensive, state-of-the-art approach allows for highly personalized treatment plans. Understanding both the health and aesthetics of the mouth is just so critical for today's topic, which is tooth discoloration.
It's a totally holistic view, and that provides the perfect launching pad for our primary focus today.
Exactly.
Because, having perfectly filled lips doesn't mean much if the teeth themselves are discolored. So let's get into the mechanics, starting with the outer layer extrinsic staining.
Right, the battleground of the enamel.
Oh.
So extrinsic discoloration refers to stains that affect the outer layer of the tooth.
Okay, so essentially like spilling coffee or red wine on a crisp white shirt. It just sits right there on the surface.
That is a perfect analogy, actually.
Oh, thanks.
Yeah, because to understand extrinsic stains, we have to discard the idea that teeth are completely smooth. They aren't glass.
Right.
On a microscopic level, enamel is highly textured. It's packed with tiny ridges and pores.
And then you add the culprits, right? Like coffee, tea, red wine, soda.
Dark foods, yeah, exactly.
Oh, right.
Plus habits like smoking, chewing tobacco, and just poor oral hygiene. Plaque and food debris buildup are major reasons teeth turn yellow or brown.
It sounds like a constant assault on the enamel.
It is. But what's fascinating here is that these stains, while they're noticeable and sometimes super dramatic, they're actually the easiest to address.
Really? Even the dark brown tobacco stains?
Yep, because they haven't penetrated the tooth's actual structure. They're primarily just a buildup on the exterior.
Oh,
So they respond really well to professional cleaning and basic whitening.
okay, so surface stains make sense. But what happens when the stain is coming from inside the house, so to speak?
Now we're talking about intrinsic discoloration.
Right.
This is when stains occur inside the tooth. It's no longer about the surface layer at all.
And the causes for this are totally different, right? Like dental injury. If someone takes a hockey puck to the mouth, the damage can actually darken the tooth from the inside.
Exactly. The trauma causes internal bleeding in the tooth, and also certain medications play a huge role.
Oh, really?
Yeah, like if you take specific antibiotics during childhood, they can affect tooth development and cause permanent bands of gray or brown.
Wow.
And then there's excess fluoride.
Okay, wait. Here's where it gets really interesting. We are always told fluoride is the ultimate protector of teeth, right?
Oh yeah, always.
It's in our water, our toothpaste.
Yeah.
But this source says too much fluoride causes brown or white spots.
I know it sounds completely backward, but if we connect this to the bigger picture, it's all about the delicate balance of dental health.
Yeah, I'm listening.
So while fluoride does prevent decay, excessive exposure, especially while adult teeth are still developing under the gums, can lead to a condition called fluorosis.
Fluorosis, got it.
Yeah, and this fundamentally alters the tooth's internal color structure. It creates these chalky white or dark brown spots.
Wow.
And because it's structural, it requires much stronger interventions than just a surface scrub. You can't just brush that away.
That is wild. The ultimate protector can actually cause discoloration. But let's say someone avoids all of that, no coffee, no injuries, perfect fluoride balance. Their teeth will still change color over time, won't they?
Oh, absolutely. And this brings us back to that surprising fact we opened with.
Right, the biological clock.
Exactly. As people age, that hard white outer enamel naturally thins out, just from a lifetime of chewing and brushing.
And beneath that enamel is the dentin.
Right. Yeah. Yes, and dentin is naturally yellow.
Okay, so this makes me think of, like, imagine a light bulb surrounded by thick, frosted white glass.
Ooh, I like that visualization.
Right. And as you slowly sand away that frosted glass over the years, the yellow light from the bulb shines through much more clearly.
Exactly.
So the tooth isn't necessarily dirty, it's just becoming translucent.
That is a brilliant analogy. And that is exactly why age-related discoloration can be so immensely frustrating for patients.
I can imagine. You do everything right and still get yellow teeth.
Exactly. They might have absolutely perfect brushing habits, but biology is simply revealing the tooth's inner layers.
Yeah.
They aren't doing anything wrong. It's just the natural march of time. The enamel thins, the dentin shows.
So what does this all mean? We are in a constant battle against our morning coffee and the march of time, but we aren't helpless, right? Omnidental has actionable solutions.
Absolutely. You do not have to just accept discoloration. It starts with daily prevention.
Okay.
Brushing at least twice daily with fluoride toothpaste, flossing, and a big one, rinsing with water after meals.
Oh, just a quick water rinse, like swish and spit.
Yeah, it mechanically flushes away those dark pigments before they can bind to the tooth.
That's such an easy dietary hack. Along with using a straw for dark drinks like iced coffee or tea to just bypass the front teeth altogether.
Exactly. And obviously, breaking bad habits, stopping smoking and chewing tobacco is crucial.
But when daily habits aren't enough, that's when you turn to professional solutions.
Right. This raises an important question for anyone listening. Are you skipping that water rinse after a cup of tea? Evaluating your own routine is step one. But yes, for extrinsic stains, regular dental cleanings, and professional teeth whitening are key.
And they use hydrogen peroxide for that, right? To safely lighten the teeth.
Yes, it chemically breaks down the stain molecules. But for intrinsic or stubborn, age-related stains, you need cosmetic dental care.
Because the whitening won't work on the dentin.
Exactly. So you look at things like veneers, prosthodontics, or dental bonding to restore a natural look.
Because you're basically replacing that frosted glass we talked about earlier.
Precisely. Combining smart daily habits with advanced technology, like the cutting-edge tools used at OmniDental, is the ultimate formula for a lasting, bright smile.
It really is a perfect blend of biology and aesthetics. Thank you so much for joining us on this exploration of OmniDental's insights into tooth discoloration.
It was a pleasure.
It's clear that a bright smile is a combination of good habits, understanding biology, and seeking the right professional care.
Absolutely. And before we go, I want to leave you with a final thought to ponder.
Please do.
Think of your teeth not just as tools for chewing, but as a living, physical diary of your life.
Oh, wow.
Every cup of coffee, every medication, every year that passes leaves a microscopic record in your enamel and dentin. The question isn't just how to erase that history, but how to curate the next chapter of your smile.
Wow, a physical diary. I love that. Well, thank you all for listening to this deep dive. Remember to keep looking for the why behind the biology in the mirror. And most importantly, stay curious. Take care.